I'm Dr. Sugun Agarwal. I'm a specialist plastic surgeon and I work at the SAN, RPA and Prince of Wales. Plastic surgery is actually a very, very broad specialty. It has two broad scopes. On one side there's reconstruction and on one side there's cosmetic surgery. My practice, for instance, is about 50% of each. On the cosmetic front, I do everything from face, body, breast work, to people who have massive weight loss. Really anything. It goes head to toe type of procedures. On the reconstructive side, I again do a lot of broad things. So some big categories are breast reconstruction, head and neck reconstruction. I do lower limb trauma in combination with some orthopedic surgeons as being part of a big public hospital. I do hand surgery, and a big part of my practice is skin cancer work. So plastic surgery is just one of those things that, it doesn't quite neatly fit into a discrete body type or organ. And we work with pretty much every other specialty on the reconstructive side. And I think that's a real advantage on the cosmetic front, because we are so well trained in pretty much anatomy of everywhere from top to toe, that as a cosmetic surgeon, I think plastic surgery is at the forefront of being able to deal with anything or any deformity. And more importantly, you know that you're going to get a safe surgeon who can deal with really anything, and should anything go wrong, you'll be in safe hands. So plastics, the name actually almost has nothing to do with the specialty when you think of it, but the way it came about was, it's from the Greek word plastikos, which was to mold or to create. And that fundamentally captures what our specialty is about. So it's a very visual specialty. We are almost, always creating something. My patient who may have cut their tendon on their hand, they don't have a tendon that's working, and at the end they start off the day without a breast, and at the end of the day they finish with a breast. It might be a deformity, they've lost a lot of weight, they've got loose skin all around the body, and they're a completely different person at the end of the day. So we are, in some ways, molding or recreating, and that is the premise. That's why it's called plastic surgery. A lot of patients who come to me for cosmetic plastic surgery are not the people who have just made up a deficit or something that I can't see. In fact, I'm very happy to tell them, you don't actually need an operation. And I think it just depends on the personality of probably the surgeon and also their patients and who you pick to do an operation. The people who come to me will be, women who are sort of in their 40s, 50s, who may have had a couple of kids. They've breastfed them, and then now they're like, well, my shape isn't the same, and I don't feel confident going out wearing, or even just going to the beach with my kids. That's pretty sad. Or undressing in front of my partner, or wearing the dress that I used to wear. It's things like that, and they actually don't ever come to me saying, I don't want anyone to know. At least that's my approach, that I don't want anyone to know that you've had some surgery, but you've regained the confidence to wear things that you previously used to wear. And that confidence is very palpable. When you restore, something, those patients are very confident and very thankful. But they're very different too. They're certainly not people who are looking for someone to say, oh, you've had plastic surgery, or you've suddenly had a change in your breast size or anything like that. Similarly, people come to me for a face or neck lift, and they just feel very conscious of, I've got some loose skin in my neck and I feel very embarrassed in a job interview or something like that. And again, they don't want anyone to ever know that they've had something, but they just want enough people to know that, oh, I look a bit refreshed, I look a bit different, but they don't want to know that they've had surgery. Similarly, if you say about a massive weight loss patient who's lost 60, 70 kilos, those people have so much loose skin that they can't fit into clothing. They find it difficult to buy clothing. They get rashes in their, in the creases of their skin. And when they lose that, we actually, you actually replace those loose skin with scars. So they're not worried about the scars. They're like, well, I can now have a great body shape. That's why I lost, the weight in the first place. But now I can feel confident going to the beach. People are not going to look at me. I can find clothing. I'm comfortable. So, I think cosmetic surgery is, not being vain at all. I think it restores people to what they, maybe were in their youth, and also regains some of the confidence in just day to day. It affects everything from shopping to spending time with your kids, to going to job interviews. So, and I think that for me is also the most satisfying part of cosmetic surgery. It's very similar to the results I get on the reconstructive side. Patients in both spectrum are so thankful that they had it.
Bye.